We are honored, ladies and gentlemen, to welcome him as our keynote speaker tonight. Would you please give a very, very warm welcome to Councilmember Bob Ferguson. Bob?
Thank you very much, and welcome to the Legislative Forum tonight. On behalf of the King County Council, we really appreciate the time you've all taken to come out and join us this evening. Neil did some thank yous, particularly to the volunteers who work so much on boards and groups, and I want to say not only do we thank you for helping us put on this event tonight, but for all the work that you do on a day-to-day basis, volunteering your time to improve the lives of people throughout King County. And for the legislators who are here today, one thing I've learned, I've only been in office for 3 years, but when I see a legislator at an event like this, their presence speaks volumes. Legislators have many demands on their times. They're invited to many, many events on any given night, and the fact that they are all here tonight taking their time to attend, again, really speaks volumes to their commitment to this important issue, so I really appreciate the time you've all taken to attend tonight. I've divided my remarks into 3 brief areas. First, I'm going to give you a very brief personal perspective on these issues so you have a sense of where I come from in addressing them. Second, I'm going to briefly touch on some good news at the county, and in fact, Neil briefly outlined a few of those to give you a sense of how things are going at the county in the positive sense. But I think to be fair, we should balance that out with the challenges that we face as we go forward, as we work together to try and improve our systems, and I'll touch on those briefly as well. So first, after college, I spent a year, I graduated from the University of Washington, and spent a year volunteering with the Jesuit Volunteer Corps. It's like a VISTA program, only here, only through the Jesuits and in the United States. And I was placed as the director of an emergency services office. This is, now it's close to 17 or 18 years ago. And it was a placement in an inner city environment. And my job was to run an emergency services office, and I helped people with clothing, with food, with their utility bills, a wide variety of services. In many respects, it was, I think fair to say, the most formative experience of my life and has really informed my politics in large measure. As you might suspect, many of the folks, or at least some of the folks who came through the doors of my office suffered from chemical dependency issues or mental illness. And it was a challenge for me to assist those folks. I lived with 6 other volunteers. There were 7 of us living in a house together. And all of us had different jobs throughout the city that we were living and working in. And at night, we would often, of course, compare notes on the experience that we had. So there was another volunteer who was helping with the homeless. There was a person who did some mental health work, someone with abused women, someone in the criminal justice system. And we'd often talk about our clients and our work. And after a period of several months, we started to realize that some of us were starting to see the same people in these different facilities over the course of our time together. And we got to know them. And it occurred to me by the end of that year that there had to be a better way to do this, that this was not the most efficient or effective way to run these programs, and more importantly, it wasn't getting the right services to these people in the manner or in the timeliness that they really need to improve their lives and help them out, as well as having an efficient system. So these issues, I guess I give you that brief background to say that these issues are not abstract to me. There's a guy named Doug Stevenson, who many of you know. He's a staff person at the county and is very involved in issues like this. And so when Doug is giving us a staff report like he was this morning, it's not an abstract concept. And I can still recall specific clients that I worked with who suffered from some of the problems that we now face today with the folks that we're dealing with. And I always told myself back when I was doing this work that if I ever had the opportunity to be in public service or hold public office, that for me these issues would be a priority. And for those reasons, I really appreciate the opportunity to say a few words tonight and really appreciate each of you and your commitment and service on these issues. So a little bit of good news. Let's start with that. 4 issues I'm going to touch on. I'm going to touch on them very briefly in the interest of time, but just to give you a sense of some things that are going on at the county level. So not long ago, and I think Neil touched on this briefly, the County Council approved the Mental Health Recovery Plan. This was with the goal of shifting our focus to individual strengths with our clients and providing the services and support that help people achieve a fuller and more independent life. The good news is we're moving forward with the implementation of that recovery plan, and this is to be celebrated. Second, we're making progress in our efforts with our many partners across the county to address homelessness. The 10-year plan to address homelessness is an excellent plan. King County was among the first to complete and adopt its 10-year plan, and we look forward to working with the state and with our legislators in building the housing and support services that will help to achieve our goal of ending homelessness in 10 years. Third, King County continues to be a leader and innovator in criminal justice alternatives while maintaining public safety. Neil also touched on this briefly. He only made one mistake. He mentioned my name as getting some credit for this. I don't get any credit for this. This is work the county's been doing for many years. And in fact, I think your keynote speaker last year was Larry Gossett of the King County Council. And he's an individual who's been working for many years and has been a true leader on this issue in getting alternatives to folks who are going through our criminal justice system. What's maybe of interest to you is that, as a result, we have reduced the use of our detention for both juveniles and adults. And, not surprisingly, we have achieved real savings, taxpayer dollars, as a result. What I find the most inspiring, actually, is that we've reinvested some of those dollars back into treatment alternatives for individuals with mental illness and dependency issues. These amounts are significant. Each year, annually, we reinvest millions of dollars from those savings back into those kinds of programs. So folks like Larry Gossett and others are really leading on this, and I think the county has led in the sense of reinvesting those dollars back into the programs that work and help people live more productive lives. Fourth, Neil also touched on this briefly, the Veterans and Human Services Levy, which went to the voters last year. I was very proud to work on this with Julia Patterson, city council members, and city mayors throughout King County. It went to the voters last year, and it brings in about $13 million annually. Half of the funds go for veterans and their families, half go for other folks. It's split down evenly 50-50, and the levy will generate more than $13 million a year for the 6 years that Neil mentioned. This year, the county made a very conscious choice to prioritize those dollars, to put together a report and decide how do we want to invest these dollars in our community. And the council chose to prioritize those dollars to fund housing and support services to support the veterans and their families and others in our community in need. So a significant portion of these funds will go to those with mental illness and chemical dependency issues. So to summarize the good news, we're doing our part. And even with limited, and sometimes very limited discretionary resources, King County is working hard to help those most in need to find the housing, treatment, and other supports they need.